Hi, Jennifer Lessie here. We are going to be intubating and inducing our patient. So we have Daisy May here. Here's her chart. We have consent from our owner to go ahead and induce for a possible foreign body. So verified this is her name. This is our patient right here. We've already given her pre-anesthetic medication, so those are on board. We've also already placed a catheter for her. In order to place the catheter, I've got the supplies here. We have tape to secure the catheter in place. We utilized a 20 gauge catheter. We have our heparinized saline solution to flush the catheter to ensure that it's properly placed. We have the clippers that we used to shave around the cephalic vein. And then we have our chlorhexidine and our alcohol scrub. So we alternated 3 times between the chlorhexidine and the alcohol to ensure that we had a sterile site prior to placing the catheter. And then we also have a catheter cap too, so that way we can utilize that vessel to induce with propofol to effect. So we have that there. Okay, we have our anesthetic machine is set up. We've already done a leak test. We have a passive scavenger system on the unit. We're using a 3-liter bag. Calculation for the bag is 20 milliliters per kilogram. Daisy is 66.4 pounds, which equates to about 30.2 kilograms. I'm going to start pre-oxygenating her. So we're going to place her on 4 liters of oxygen per minute. Okay. Good girl. Excellent. And so then Dr. Smith is just going to hold for us. So she's at 4 liters per minute. The isoflurane is turned off right now because we don't want any anesthetic agent. Our pop-off valve is open, and we have our reservoir bag. Again, that's a 3-liter bag. We can see inflating with her breaths. So she's good there. You can also see her catheter placement as well. All right, so we're going to start her on her oxygen. So she's going to sit there as I'm reviewing our monitor and our tube placement. So we need to have 5 to 7 minutes of pre-oxygenation, and so that way she is well oxygenated, which we'll get to. She'll have what she needs. So for our monitoring equipment, we have our blood pressure cuff right here. Our blood pressure cuff is going to automatically measure her blood pressure, which is going to give us a good idea of her plane of anesthesia and her cardiac pressure. So we also then have our capnograph. Our capnograph is going to measure her end tidal carbon dioxide, which then will initiate her breathing or her respirations, and it does have a respiratory monitor in it as well, as this is a digital capnograph. So we have our capnograph, our blood pressure cuff, and then we've got our ECG esophageal probe. This is our electrocardiogram, so it's going to be measuring our heart as well as our temperature. So we do have a thermometer in this probe as well, so we're going to be able to get a core body temperature of Daisy throughout her procedure. And then we have a pulse oximeter. This is going to measure our oxygen saturation. We'll put this on the tongue or on the ear so that way we can get a clear reading of that on a blood vessel. Then we also have our esophageal stethoscope, and this is going to allow us a manual reading of our respiration, of our heart rate. Also, we'll be able to hear her any lung sounds as whatnot as well. So our esophageal stethoscope is going to allow us to manually monitor and make sure that all of the machine is working properly. So that is all of our monitoring equipment and what it does. We already reviewed her catheter and that placement there. So now let's boom, boom. All right, so we have our tray of intubation equipment. So I've got a laryngoscope in case I need it to assist in visualizing her arytenoid cartilage, as well as the epiglottis and soft palate. I have 3 different tubes. As I said, she is 66.4 pounds or 30.2 kilograms. According to our textbook, at 25 pounds, we would use a 7.7 tube for lean mass, and then for every 5 pounds, then we would go up 0.5 on our tube size. So with her lean mass would be more toward that 58-60 realm for pounds. So we're gonna have a tube of 9.5 is the tube we're gonna attempt to place. So I've got a 10, a 9, and then also a 9.5 tube. And then when we place the tube, we're gonna measure between her thoracic inlet and her larynx. So that's where the tube should be placed. And then it should be no more than 2 inches past her canines. So that 9.5, let's see it right in her thoracic inlet, there's her larynx. So her canines are right around here where that 30 is. So I'm gonna go ahead and place my tie. I'm just gonna do a single knot. Around that 30, so that should be about where her canines are going to be when it's placed properly. I'm making sure that I don't have that string for the cuff for our endotracheal tube, and I'm also going to go ahead and inflate that cuff to verify that there's no leak in the balloon portion. So I do have that empty syringe that I'm going to use to do that. I have my 20 cc syringe to pull out my Propofol. We'll go into that dose calculation in a moment. I've got my eye lube for her, some extra needles if needed, a gauze square, so just in case for the Propofol or for the flush, a gauze square to hold on her tongue. I also have sterile lube, so I'll go ahead and lubricate the beveled edge as well as the balloon of the endotracheal tube prior to passing the tube to assist that in a smooth passage. So we've got the sterile lubricant packets, and then I do have the Propofol here as well for when I'm ready for the Propofol induction. So we've got that. So I'm going to go ahead and test the tubes. I'm going to inflate the cuffs. As I do so, I'm going to be palpating the cuff right up in here, and then as I palpate here, I'll be able to feel a pressure as well as feel that in the balloon as well. So as I push down, it'll push more of that air there. I'm not seeing anything deflate, so I have some pretty good pressure and resistance. There's no gunk on the edges, so I'm also checking for that. So that tube looks good. If I were concerned about a leak, I could take a bowl of water and then submerge the balloon into that bowl of water and look for little air bubbles. And so now I'm deflating the cuff to ensure that it's going to go smoothly down, and I'm going to check the 10 tube as well. Okay, so I'm pressing pressure on the cuff, visualizing and also feeling the balloon. So its pressure is maintaining. I can feel that give back and forth. So there's no leak, there's no gunk. So the number 10 is good, just in case that 9.5 is too small. And then we're checking our 9 tube as well. So there's no gunk there, so that's clean. And then I'll inflate. Okay. All right, so I can squeeze both ends, the cuff and the bag, and we are maintaining pressure there. So there's no leak or no sign of a leak in that tube either. Okay, so we've got everything done there. I'm going to keep that open and on my table, and now we've got our Propofol. Our doctor has ordered 5 mg per kg of Propofol to be given to effect. If for some reason that dose is not adequate for her and we need to pull up more, then we're going to calculate that at 1 mg per kg, as she is 30.2 kilograms. That equates to a dose of 15.1 mils to pull up if in my syringe of the Propofol. And then if need be, I've already calculated that, we can pull up another 3 mils if needed, if for some reason it doesn't take effect. Now, or to get it to its full effect. When giving the Propofol, I'm going to give it slowly over a period so we don't have respiration depression. So I'm going to go ahead and pull up that Propofol now. I have my 20 cc syringe. I'll label for it so I know that this is the Propofol. Got my needle to pull up the Propofol. And as I pull it up, I'm going to make sure that I remove any air bubbles. And again, I'm going to pull up 15.1 cc's or 15.1 milliliters. Just clearing that of all the air bubbles that are in there. So we removed our air bubbles and we have 15.1 cc's of Propofol. Okay, so recap that. That's waiting, ready to go. So and she has definitely gotten 7 minutes of pre-oxygenation. So we have met her pre-oxygen requirement. What I'm going to do is flush her catheter to ensure that it's still working. Again, I'm using a heparinized saline solution to do that. I'm going to then inject the Propofol slowly, and in order to verify that the Propofol is taking effect, I am going to check her palpary reflex, although that's not the best indicator, so then I'm going to check jaw tone as well. If for some reason her jaw tone is still a little tight, I'm going to re-oxygenate and place more Propofol. That way we're not desaturating her at that time. So I am going to check jaw tone, remove the oxygen. If we're good on jaw tone, I'll replace the mask and then set up the endotracheal tube with the sterile lubricant. If jaw tone is not satisfactory, then we'll inject. If there's remainder of Propofol or having to pull up 3 more cc's of Propofol, we'll do that. And then I'll check jaw tone again. Once we get that set, I'm going to place the tube pushing up on the small palate and scooping down on the epiglottis so I can see the in between her arytenoid cartilage and insert the endotracheal tube. I'm going to look for condensation in the tube, and then I'm also going to give her breath. When I inflate the cuff, I'm going to inflate the cuff once, and then I'm going to give a manual breath, listen for a leak, and then if the manometer doesn't maintain at 15 to 20 centimeters of water, then I'm going to place more air into that cuff to ensure that the cuff is completely pushed lightly, not too much on her trachea, so we don't rupture that, but that way there's no leak between her trachea and the endotracheal tube. So then that'll happen pretty quickly. All right, baby girl, you ready? Yeah. All right, so I'm going to go ahead and flush her catheter first. Okay, and I can feel the flush in her vein. And so we use 3 cc's of heparin saline solution to flush the catheter. Now I'm ready to put in with the Propofol. We're still oxygenating at 4 liters per minute. Okay. So I've given about 5 milliliters of Propofol. Everything's still looking good. She's still alert. Okay, so she's gotten about 10 milliliters of Propofol. Okay. All right, I'm going to go ahead and check her jaw tone. She's gotten 13. Okay. All right, so I'm going to check her jaw tone. Okay. It's a little tight still, so I'm going to give that remaining 2 cc's of Propofol. So we're going to place the oxygen back. And then I'm going to flush that catheter. And using heparin saline solution. And then I'll check her jaw tone again. There we go. That's better. So we're going to go ahead and keep the oxygen on. And then I'm going to get ready the tube. So we are using that 9.5. And I'm placing the lube on the bag as well as the tip of that syringe, or the tip of the beveled edge of the endotracheal tube. And I'm letting gravity be my friend and coating that. Okay. All right. So we've got that lubricated. So I'm going to go ahead and open pull out the tongue without pulling too forcefully. And I'm going to hold that tongue between the bottom canines. Ready? Yeah. Okay. Got her tongue. Perfect. Alright, so I'm going to use again the beveled edge of the tube, lifting up on her soft palate. And then I can see the arterionoid cartilage, so I'm just going to go right in there. There we go. And I think I went in. I don't see any condensation on the tube, so I'm going to pull it out once and then try one more time. Okay. There we go. Alright, so the tube is placed. I can see the condensation on the tube, so I'm going to tie behind the maxillary canines. And then once that's tied, I'm going to get the oxygen back on. And I'm going to inflate the cuff. Okay. Alright, there's good pressure there. I'm going to go ahead and check for a leak. So I'm going to close the pop-off valve and squeeze the bag. Okay, so I am closing the pop-off valve. Okay. Squeezing the bag to hold at 15 centimeters. It's holding at 15 centimeters. I'm listening and I don't hear a leak. So we are good there. I'm going to open up. Alright, so the tube has been properly placed. I was able to give her breath. It held. Now I'm going to go ahead and drop her down to 1.5 oxygen and up to 3 on her isoflurane. So she was tied, she's intubated, and I loop her eyes and her breath. There was no leak with the cuff, so we were successfully able to intubate.